everyone, today I will talk about self-harm awareness, understanding, healing, and support. First, we will answer the question, what is self-harm? Self-injury or non-suicidal self-injury is the deliberate and direct infliction of harm to one's body without intent to die. Self-injury is recognized as a mental health problem because it reflects severe emotional distress and poor coping capacity. It is a significant psychological issue that commonly occurs alongside depression, anxiety, PTSD, and borderline personality disorder. And there are some common methods, including cutting, burning, scratching, heating, or interfering with wound healing, and it acts as a temporary coping mechanism, not a suicide attempt. However, repeated self-injury increases risks of serious harm or suicidal behavior. These are recent statistics on self-harm in Australia 2023-2024. Females accounted for around 2/3, 64%, of all hospitalizations for intentional self-harm. And although females experience higher hospitalization rates, suicide deaths remain higher among males, partly due to mental lethality and lower health seeking. Also, young people continue to record the highest self-harm rates. Females aged 15 to 19 years is the highest of any group, following by females aged 20 to 24 years, and males aged 15 to 19 and 20 to 24 years is less than half female rates. Since 2008-2009, young rates have increased steadily, peaking in 2020 and 2021, and have since slightly declined but still remain high. Moreover, the rates of intentional self-harm hospitalization are higher among people living in low socioeconomic areas. In 2023-2024, the rate in the most disadvantaged areas, quintile 1, was 122 per 100,000, nearly 1.9 times higher than the least disadvantaged areas. Next, we will talk about underlying risk factors of self-harm. The first one is psychological and emotional factors. Depression and anxiety are among the strongest predictors of self-harm, often driving individuals to use physical pain to manage emotional pain. Emotional dysregulation can lead individuals who feel overwhelmed or hopeless to self-injure as a way to regain control or release tension. Co-occurring mental health conditions such as depression with anxiety or PTSD significantly raise self-harm risk. And the second risk factor is impact of childhood and family environment. Early childhood trauma, including physical, emotional, or sexual abuse, and family conflict or neglect greatly increase the likelihood of self-harm later in life. Children raised in dysfunctional families with low emotional support, poor communication, or ongoing parental conflict often develop feelings of isolation, rejection, and low self-worth. Such early adverse experiences can impair emotional regulation, making self-harm a learned way to cope with unresolved pain and distress. And another one is lifestyle and behavioral risks. Substance use, poor sleep, and excessive screen time are significant behavioral contributors to self-harm. Individuals who rely on unhealthy coping mechanisms or impulsive, risk-taking behaviors often engage in self-harm to manage emotional distress, and poor lifestyle habits can worsen mental health symptoms such as depression, anxiety, reinforcing a cycle of self-injury. Another risk factor is socio-demographic factors. Higher rates of self-harm are observed among individuals from low socio-economic backgrounds and rural or remote areas with limited access to mental health and crisis support services. Social isolation, financial hardship, and geographical disadvantage further intensify vulnerability by restricting access to timely, culturally appropriate care and community support. There are some interventions for self-harm, including pharmacotherapy. Medications are not specifically for self-harm, but are used to treat co-occurring disorders, and the advantage of pharmacotherapy is reducing the severity of underlying mood or anxiety symptoms, which may reduce self-harm impulses, being a useful adjunct to psychotherapy. However, no medication cures self-harm behavior itself, and risks of side effects, interaction, and misuse should be considered. The second intervention is self-help, psychoeducation, and supportive interventions. Strategies including peer and community support, psychoeducation, phone or hotline supports, and mindfulness exercises. The advantage of this intervention is accessible, low cost, and can be used immediately, and it also empowers individuals in socio-economic areas. However, it would require good self-awareness and stability to use effectively, and it not address deeper emotional or trauma roots without professional support. Come to the next part, we will talk about the relationship between trauma and self-harm. First, I will answer the question how trauma interacts with self-harm. Trauma, especially in childhood, is a major risk factor of self-harm. People with traumatic experiences often develop emotional dysregulation, guilt, or shame, using self-injury to release distress or regain control. And trauma affects self-response and impulse control pathways, increasing vulnerability during emotional crisis. Without trauma-informed care, treatment may re-traumatize patients and reinforce self-harm cycles. Trauma-informed care acknowledges the role of past trauma in self-harm and aims to promote safety, trust, empowerment, and healing while avoiding re-traumatization. The advantage of this intervention is address the underlying trauma, a common root cause of self-injury, and is also reduce flashbacks, emotional dysregulation, and trauma-related triggers. It fosters the empowerment and self-understanding through safe, guided therapy. However, some methods can be intense or triggering if not carefully managed, and it also requires skilled, trauma-trained clinician and ongoing support. It takes longer to show results, especially with complex trauma. In conclusion, these are some highlights about self-injury. Self-harm is a complex coping behavior linked to emotional pain, trauma, and mental health disorders like depression, anxiety, and PTSD. Young females and those from low socioeconomic areas have the highest hospitalization rates. Trauma, poor emotional regulation, and limited social support are some key risk factors, and we need to use holistic treatments between combining pharmacotherapy, self-help, trauma-informed care, and family community support as the most effective intervention. And studying SNUG206 have deepened my understanding of self-harm as a coping mechanism, not merely a symptom, and I also learned the importance of empathy, non-judgment, and trauma-informed care when supporting individuals. This subject has shaped my perception, moving from viewing self-harm as a risky behavior to recognizing it as a cry for safety, understanding, and healing. As a future nurse, I feel more confident to provide compassionate, culturally safe, and person-centered mental health care. And that is all for my presentation about self-injury. I hope that you enjoy it. Thank you for your time listening to my presentation.